fatty liver, obesity, diabetes, and high cholesterol. What age group of people comes to mind when I talk about all of this? Are they people in their 60s, late 50s, maybe in their 40s, right? But no, I'm talking about children here. Did you know that in 2016, an article that was published in the Journal of Indian Pediatrics stated that nearly 22% of children who were examined had fatty liver? And these are not children who were obese, but children who were of normal weight according to their height. There are also reports that in referral centers for diabetes, nearly 26% of the children who are going to them or are referred to them have diabetes type 2. You may already know that diabetes is of three types. Diabetes 1, which is mainly seen in children. These are children who are not able to produce enough insulin in order to break down carbohydrates and glucose in their body. So they need insulin injections daily. Diabetes type 2 is amongst adults usually. And today we see more and more diabetes even amongst young adults. The fact is that there are also children today who have diabetes type 2. Diabetes type 2 is mainly associated with lifestyle and food style, and it is also associated with insulin resistance. In fact, insulin resistance is known to be the cause of diabetes type 2. And then we, of course, have gestational diabetes. Gestational diabetes is seen in women during pregnancy when their glucose levels goes very high, and usually they need medication or insulin in order to bring it under control. The other thing that we are seeing in children is the increase in obesity. In fact, there are reports that say that by the year 2030, 1 in 10 children will be obese in India between the ages of 5 and 9 years. Central obesity, which is collection of fat around the abdomen, will increase to 9% in some of the urban cities. In fact, in my own practice, I have seen children who are pre-diabetic, who have high cholesterol and fatty liver as well. Of course, I do not deal with pediatric nutrition. I always refer them to somebody else. But like I said, the incidence of these cases in our country is increasing, and it is time for us to do something about it. To the Wellberry. I'm Dr. Nirmala, and today we are going to talk about the signs and symptoms of metabolic syndrome in children and what we can do about it. And for this, with us today is Dr. Soumita Adhikari, who is a pediatrician in the UK. Soumita and I have known each other for nearly 30 years because we studied in medical college together. The reason why I decided to interview Dr. Soumita was because she also has the experience of having worked in India. She used to work in Calcutta for many years as well. Hi, Dr. Soumita. Welcome to the Wellberry, and allow us to pick your brain to know a lot more about what metabolic syndrome and the signs and symptoms of metabolic syndrome amongst children are. And probably you could help us understand what we need to do in order to prevent it. Or if children do have it already, then what do we need to do so that it doesn't affect them for the rest of their life, right? So welcome.
Yeah. Thank you. Thank
Yeah.
you for having me.
According to you, Dr. Soumita, do you see an increase in the number of children with metabolic syndrome related conditions? And what, according to you, is your experience with them?
Past decade, we have seen quite a sharp increase in the number of metabolic syndromes kids presenting with, and the lower age group even being about 5 to 10, which is a bit scary. We have been seeing high cholesterol, kids with fatty liver, kids with type 2 diabetes. And also we have been seeing few of the adult diseases in the kids. And they present with the main cause, what we have been able to link up is childhood obesity. Childhood obesity plays a very important role and a reason for especially fatty liver and then going on to high blood pressure. So main cause is we are facing is your childhood obesity, which has increased in the past decade. In India, I think it is probably about 25% in the urban India, and in UK, obesity is like 1 in 10, which is scary, which is really scary.
Yes. And so when you say that metabolic syndrome, obesity especially, has been increasing, do we normally test children for insulin resistance, or are we still going old school and trying to control it with just by making small modifications in the diet and maybe through medication as well? And also, obviously, we always stress on make the child go outdoors and play and things like that. So, as a doctor, what do you think the stress is on now when we see children presenting to the clinic with fatty liver or diabetes?
So what we do when we see them in presenting with those two, we obviously fatty liver. We try any children which we think they are obese. We try to get this blood test done for the alanine transferase um, levels, which are high, and so that is one of the screenings which we think it should be done to keep an eye, especially for the fatty liver, because fatty liver, they come with the symptoms very late. So it's when the scarring sometimes begins, then they come with, because simple fatty liver that has no inflammation and so very symptomless, so they can actually to the go to the next level, which is the steatoric hepatitis, and then the scarring starts, and then they start getting symptoms. So we are trying here in UK to get the levels of alanine transferase the moment we identify childhood obesity. And at the same time, we also, if there's a history of diabetes in the family, we try and get insulin resistance, blood sugars done, and regular monitoring of blood pressure at least once in a year is also very important among the kids who are overweight and prone to childhood obesity.
Okay. So insulin resistance is still not actively done unless there is a family history of diabetes, a very clear family history of diabetes. Did I understand you right?
Yes, yes.
Okay. So that means the world over, we have to start recognizing what a big role insulin is actually playing in all of this and start being a little more proactive in terms of diagnosis and helping parents deal with children who have insulin resistance. In
Yes.
Yeah. Yeah. So, in order for our viewers to understand, what exactly do we mean by fatty liver and why is it a problem? And the third part of that question is, apart from you said you do blood work, the alanine transferase to see whether a child has fatty liver or no. Apart from that, what are the clinical signs that we would see in a child with fatty liver?
So fatty liver is excess deposition of fat in the liver, and that is the main cause is we have identified as sedentary lifestyle, poor eating habits, and in another way again obesity comes into play here. And we broadly divided, and it is all fatty liver is also the gateway for metabolic syndromes. For example, it goes into your heart problems and then goes into your if untreated hypertension as an adult. And again, it can also lead to type 2 diabetes. From the teenagers, we can actually see them if it is undiagnosed at that level. So fatty liver, we have been broadly able to classify it into two, which is the simple fatty liver, and the second one is the non-alcoholic steatoric hepatitis, which we call as NASH. So the simple fatty liver is actually where there is deposition, and but there is no actual inflammation of the liver and the cell hasn't been damaged. So at this point, if intervention and screening is done, then we just by lifestyle changes, things can be reversed. Okay. Because there hasn't been any scarring or fibrosis. Active fibrosis scarring hasn't taken place in the liver. And the second type is the non-alcoholic steatotic hepatitis, where the fibrosis and the scarring has started. And then if it is not treated and not identified, then it will lead on to liver failure and liver cancer in the adulthood. So that is the progression we need to treat. And the good thing about liver is it is an organ which is capable of regenerating and recovering. So that is the good thing. So even at this level, if we intervene and we identify, it is still very, very possible to regenerate and to prevent liver failure.
Okay. I was also talking about some studies in India which state that not all children with non-alcoholic fatty liver are obese. In fact, they have even seen fatty liver in some normal weight children. Is that something that you have experienced as well?
Not in UK. I think it is more predominant in children with who are obese or overweight,
Okay.
and who have this uh, dietary habits are quite poor dietary habits and lack of physical activity. Actually, post COVID, there have been more incidents
Okay.
of childhood obesity going on to identifying fatty liver. It has been.
Okay. And according to you, uh, yes, you've been stressing on it is food and also lifestyle related, because actually fatty liver is something we used to see in adults, and especially when it came to alcohol consumption, even if it wasn't a
Yeah.
lot of scarring in the lungs, in the liver, we would still see fatty liver amongst those who regularly consume alcohol. So is the food alone and the lifestyle alone responsible for so much of changes in the liver?
There is a genetic factor, which we know there is a genetic factor, but that, keeping that aside, I think these two factors are more important, and we should stress them more because they can be altered and it will help in the long process.
Yes.
there
Yeah.
are there are other causes because all are interrelated. For example, hypertension, obesity, diabetes. So they are all related, and then alcohol comes into play in adults. But nowadays, even teenagers are consuming significant amount of alcohol. So that also has an effect.
Okay. And so even if the child is genetically prone to fatty liver because of insulin related issues, what you're saying is by making the right changes at the right time, we can prevent them from being young adults with diabetes or young adults with hypertension. Did I understand you right?
Yes, absolutely.
Okay.
And that is what we are stressing in the community here, because in UK the setup, we don't want children to come into the hospitals, in the sense that when they are in the hospital or when we are looking at them, that means they have got symptoms and which need to be treated at. But we want that the whole message for us pediatrician to the community pediatrician is that we want it to be primary prevention rather than going into secondary prevention.
Exactly, exactly. I agree with you 100%. And that's why we are doing this whole video as well.
Yeah.
So,
Yes.
if a parent needs to kind of figure out, is their child having these kind of metabolic issues, which could later on lead to diabetes or, like you said, hypertension or high cholesterol, what are the signs that they would look for in the child? I mean, yes, we will talk about the food part later, but how does a parent know that, okay, fine, it's time for me to kind of get these things checked out for my child, and probably have a talk with the pediatrician about all of this?
First, for any child at this any level, your activity level comes down. They are lethargic, they are not excitable at the right time, more sleepy. So from this is from a smaller age group, and sometimes in a even at the higher, in a mid, from your double like 10 to 14, again, the same things. The feedback basically is your activity levels go down. They want to be more in at home. They want to sleep more. They are not excited about doing things. They don't want to go to school. And sometimes there is eating habits change. They want to eat more, and then vomiting, your frequent vomiting. That these are some of the peripheral signs which parents might pick up, because it is very difficult for parents to pick up jaundice, or the signs and symptoms which doctors or professionals can pick up. So these are probably, I think, at the pediatric age group of 5 to 10, more activity is the most important thing.
Okay, so you're saying
Decreased
the
level
child
of
tends to
activity.
become a lot more lethargic. The child complains of tiredness. We may also see that the child
Aches and
has,
pains,
yeah,
which is vague aches and pains.
very vague. And also,
Yes, sometimes they may not even like to eat.
hmm.
Yeah.
Okay, because they're lethargic and they don't want to eat, because they're also the energy expenditure is not proper for them, right? We also see a lot of amongst adults, it's easier to for them to kind of report brain fog. I'm sure children wouldn't even realize that what they're facing is a lot of brain fog, right? Children who need not able to concentrate in class, not able to recollect what they studied that day. So yeah, signs of brain fog as well, and which is something that parents could um, probably pick up and then bring.
Yes, I mean, from the, I mean, the parents teacher meeting, there could be a feedback from the teacher that he has not been concentrating in class, or he is not able to give his homework on time.
Like you said, you are seeing this in children who are between the ages of 5 and 10. That's what I saw amongst reports in India as well. Is that what you're seeing in the UK?
Yes, I mean, it has increased in that age group a lot.
Okay. So I think one of the signs that parents can also pick up on is central obesity, right? Fat collection around the abdomen. Maybe the
Yeah,
rest of the child is
abdomen.
slim, but the abdomen seems to be protruding and there seems to be fat collection around the abdomen. And that's something that parents would need to make note of. The thing is that most of the time we think it's puppy fat, right? And we are always saying that the child will grow out of it. But if the parents are knowledgeable, if they have the adequate information, then they can actually see whether the child has fatty liver and then bring about the necessary changes. Would you agree?
Yes, here in UK, because the children are almost regularly monitored till the age of 9 to 10, the height and weight. Even in the school, the school nurse comes and gets the height and the weight. So it is mostly caught there, that part. Uh, so that way, yes, then it's written there, and the school nurse takes it from there and informs the community pediatrician, and then it gets sorted almost there. So
I know this is a very tricky question because most of us struggle with it, especially when it comes to adults. I struggle with talking to adults about nutrition because it's something that people are very defensive about. But as a pediatrician, what would you advise a parent who comes to you with a child who has issues of metabolic syndrome?
so it has to be a common effort that in the house, whatever the parents get food in the house, they have to decide and make an active choice that they will have to get healthy options in the house, so that the rule is same the for all the people in the house, and not only for the kids. So that is very important, otherwise they will oppose.
Hmm.
uh, they will not like to eat something that the adults are not eating. So it always has to reciprocate, because we always look up, the children always look up to the parents and also the peers. So as at home and also in school, that is the most important two places where they interact. Not only the parent, the child also needs to be there. And the child, we have to make the child understand that junk food, or different kinds of food, that can hurt. the child, and then include them in the active choice of foods and the diet and altered dietary habits. Because if we are only confining it to the parent, it is not going to work. We have to get the child also with the parent, because it is a learning process for both of them. And we have to give them the facts, like, and let them choose. And we
Yes.
have to give them information in the
Yes.
form of leaflets. That's what we're doing.
Yes. In fact, there are, YouTube videos and Instagram videos where parents are teaching children, if something has added sugars in it, then
Yes.
do you want to actually choose that? Right from the age of 4 and 5, children are holding packets of cookies and then telling their parents, no, I don't want this because it's got added sugar. I'm not saying that the child will never have a piece of cake or a piece of chocolate again, but
Yes.
children are beginning to learn that it's possible, let me say, it's possible to make children understand right from a young age that there are good foods and there are bad foods, right?
Yes, actually, in UK, in the nursery, we have tried to incorporate that among the different, the play that they do. The kids are taught in the with play. So in that, we have advised them to use different kind of foods, and divide them among not good and bad essentially, but not so good and not so bad, kind of differentiate them like that.
Yes.
So the food that the nursery gives, they have to actually sit and analyze one of the weeks every week.
Mm.
So that kind of small steps to begin with.
Okay. So, in fact, I think it has to be done side by side with the adults and with the children because, for example, in India, you know this, most of us think that jaggery is okay. Sugar is bad, but jaggery is okay. But I think most of us today who know about nutrition, who read about nutrition, we know that jaggery is just as much fructose and glucose as much as the white sugar is. And in fact, it's when you process the jaggery so much and when you bleach it that you're getting the sugar. In terms of the properties and in terms of the insulin spikes, it nearly has the same effect. Instead of that, if parents can start sweetening foods with fruits, like use a banana or dates instead of actually
Fruits.
using jaggery, that would be a better option. So I think it's time for us to do the education, not just for the children, but for the adults as well, so that the right information goes out, right? How to read food labels, how to, make sure that your child is getting enough protein and enough vegetables, what's the importance of fiber. All of these things are not just, I mean, adults, even us as doctors, I don't think we were so aware about all of these things while we were studying, not as much as we are aware of it now.
Yes, absolutely. I mean, looking at food labels, I don't remember we were actually actively doing that.
Yeah.
So yes, we have to start doing it. And you're right, the parents also need to be more, and I think the parents are getting more aware. But with technology and with the nuclear families, parents both working, it is not easy
It is.
to have only cooked food at home, which is ideal. But again, usually in UK, when they are small, even before weaning, when we start, we tell them for weaning, we are very clear that you're not supposed to add any extra salt or sugar in the food that you're cooking for a 6 months old baby.
Okay, I'm glad you brought that up because that was my next question to you. What do we do today? I mean, there's so much of packaged food. In fact, our breakfast, especially a child's breakfast, starts with breakfast cereal, right? Every home today has,
Yes.
whether it's the Cheerios, whether it is the Chocos or the Kellogg's, it starts with breakfast
Absolutely.
from a box. It's no more homemade breakfast. And I understand the kind of pressure women go through, or even men go through to have to cook when they are working outside of the house. So, do you have any kind of suggestions for that? How do we stop this, ready-made food culture that we have?
For breakfast cereals, I am not totally against the cereals, but you have to look for the right kind of breakfast cereals that you're picking. And it can be a good kind of an activity if you do that with your child, because for everything nowadays, packaging food, it is very important because children look at it. There's advertisements in the TV, newspapers. So it's a good idea to both of them working together, parent and child, and you probably look at the fiber content. So they should be having more fiber content. You should be choosing, the parents should be choosing breakfast cereals with more fiber content, at least 3 grams or more per box. And then about 5 to 20, between 5 to 20% of sodium is also very important, because some of the labels, some of the cereal boxes, they have either too less, or too more. Too more is also not good. So that, and then fortified always with the vitamins and irons and zinc. I mean, those probably, and of course, we are looking at the sugars, the one with the least amount of sugar.
Yeah. So
Yeah.
I think I don't know what kind of choices we would have in India for cereals that are having the kind of nutrient value that you're talking about. We still, and I think it's a good thing if parents, like I said in one of my earlier videos, it's the parents who can be the voice for the children and ensure that quality food starts coming out. And uh, even when we talk about schools in India, there are some schools that are very active in terms of making sure that the kind of food given to the children is good. It's nutrient dense, whole foods, tasty, of course, given to the children. But many school canteens today do not actually look at what is being given to the child. You have an overabundance of your 2 minute noodles and your burgers and pizzas. So it's in India, I think it's high time parents actually sat up, took notice, and took charge, because they are the ones who can actually make a difference. They are the ones who can go to schools, sit down with the administration, and make the required changes.
Absolutely. And I think fruits should be a very important part of the diet, because it's easy to carry, it's easy to consume, and it is natural and wholesome. It is full of minerals and vitamins. You get your sugars also in there. So I think fruits should be a regular, at least three fruits, if I would say, among the young growing children, to be a part of their diet at any time, because it's very easy. I mean, the child can carry the fruit and he can eat it. You don't have to once they are 6 7, you don't have to cut them into pieces.
Yeah.
They can consume on its own.
And
So
give the fruits
as a
along with some
pediatrician, yes,
nuts, and give them some nuts
yes,
along with that. Give
those
them
are
some,
very healthy.
yeah.
Absolutely. Nuts, if they are not allergic, absolutely they should go for almonds, 5 each, or cashews. So that is a very easy way of putting your good fats, your proteins in there, and without any effort. And also, you know that you're having natural food and there's no packaging involved here, nothing artificial in there. So yes, those two are very good source of a whole, should be a part of the balanced diet, definitely. So egg is very, very important if somebody is non-veg. Egg is also very important, and you can have it in any form. So many different forms you can have eggs. So an egg, even 2 eggs a day, is actually quite good. For kids, they can have three eggs also. I mean, that's absolutely fine. So a wholesome diet, and then fruits, of course, vegetables. In my opinion, as a pediatrician, yes, it is difficult to cook every day, but you can have carrots, you can have celery. You don't need to cook them. You can have them as a salad. Yogurts also should be quite an important part of the diet. And so these few things, and I am not great recommending fruit juices. I would rather have the fruit as a whole
Yes.
and not juices, because once they have a kid is grown up to crunch an apple, I think should be all right.
Yes.
Not to make juice
Not
and
the
give it to
apple
them.
juice and the orange juice. Yeah. Because all
No,
the fiber, all the vitamins, everything is gone out. It's just the water and the sugar that comes out in the juice.
absolutely.
And you need a
Absolutely.
larger quantity. So a child who already has metabolic syndrome, who has insulin resistance, you are going to be loading them up with more and more fructose, which again the liver is going to struggle to digest. So yeah, fruit juices, not just for children, even for adults, I say it's not the best option.
Ab-
Yeah.
Absolutely. And the junk foods,
Yeah.
if you get even Diet Coke, I mean, I don't think Diet Coke, there's something called Diet Coke. I am appalled by this. I don't understand this concept of Diet Coke, whatever. So probably not get a lot of your junk foods, in the sense, these the all the kind of fizzy drinks.
Yeah.
There's no need to get crisps. I mean, they are full of salt. Better
And
to
they
make
have sugar. We think they have only salt, but they have sugar as well. Most
yes, I mean,
crisps have
of
sugar.
course, and the salt is added. Like,
Yes.
you are having sugar also and salt also,
Yes.
so both are so harmful. So
Yeah.
keep it simple, drink water, and water is best, and drink a lot of fluids. That is also very important for gut health. I mean, we need water or fluids to push that food out for a proper, gut health. It is Fluids is very important, and probably water is the best thing to carry around.
Yeah. So you can, and also things like in India, we can speak about things like buttermilk. You said yogurt, but even buttermilk is a good option. Because,
Absolutely.
yeah. And you brought up about gut health. So I think today there is more and more acknowledgement at how important gut health is right from the time the baby is born. Gut health plays such an important role in the brain development, in the development of neurons, in making sure that the child does not end up with chronic diseases, right, in adulthood. And it starts right from the way the gut is being populated by the microbiota, right from the time the baby is born, right? And for that, we also have to ensure that we are not polluting the intestines with all the kind of junk food that is so easily available today. Sometimes I sit back and I think about how many children, when they come back from school today, the snack that they are given is either biscuits, again loaded with sugar, refined flour, some kind of hydrogenated oil or processed oil, which is not good for the body, or else it's so easy for the child to have a donut. It's no more, like you said, it's no more fruit, it's no more nuts, it's no more homemade healthy snacks. These are not options that many children have today.
I mean, I would say for energy bars, probably a better option than these briskets and donuts. So if it has to be a packaged food. So make it as less sugary, but also the child chooses it, so he's happy with his choice. Give him a platter of choices, like fruit based, yogurt based energy bars. That will fill him up also. Take care of the child's gut health, and also all around more of a balanced kind of a diet, rather than having biscuits. And milk, I think, if they are not allergic to milk, to lactose, milk is a very good option, other than water.
Yeah.
Very, very healthy option,
Okay.
without
And
any sugar in the milk.
yes, without sugar,
No
because
sugar in the milk, please.
yeah, in order for the child to have milk today, we are adding all kinds of stuff. Like we add the chocolate powder, the cocoa powder. We add sugar if nothing else, right? In order to make the milk palatable. But the children should be taught how to not, or rather, we should not train children to have that dependence on sugar in order to eat. I think it's very important today. What about children who are being weaned? I know you spoke about weaning, and I am kind of concerned about it because you worked in Calcutta for so long. You know that in India today, weaning foods come out of a box, especially because of
Yeah.
convenience. and also because it's easier to make the child eat, right? But what do
Easy.
you think about weaning foods that come out of a box? I'm not going to mention companies and all of that because I'm not here to bash companies,
Yes.
but I want people to have information.
The packeted ones or out the box, they have more energy dense kind of stuff, more salt in them, which is not good at all, especially at the 6 months to 1 year of age, because the kidneys can't process that amount of salt. Sugar, that extra sugar is also not needed at all, because again, then you're loading the blood with sugar. So it can be a part of a balanced diet, but it cannot be the only diet. And I understand the dilemma in today's with today's parents, with both of them working. It is not easy, but I think it is not difficult also if we decide and plan a bit ahead.
Yes.
Because when they are 6 months old, okay, you have to give them fruit juice because they can't chew the fruit. Agreed. So you have to mix it with about 1 part and 10 part of water. That's what we say, so that the sugar neutralize, and make the juice with the fruit. And as they progress and as the tooth comes out, and make it a bit firmer, like once they are 7 8 months and they have got their teeth out, you can give them sticks, celery sticks, you can give them carrot sticks,
You can mash
cucumber
the food and
sticks,
give them.
mash. And in between you can mash, you can give apple, boil the apple and mash it and give. No sugar, you don't need to add any sugar or salt. This is very basic
Yes.
to the kids food. You don't have to. And then what happens, the child does not crave for sugar, because from small the child actually hasn't had a taste of added sugar.
Yeah.
So they will not crave for sugar in the milk in future.
Hmm.
So then you have taken the sugar out of the
Craving
diet
out.
almost.
Yeah.
Yeah.
And the other things that you kind of, when you're talking about food that comes out of a box, especially weaning foods, they contain maltodextrin. They contain a lot of emulsifiers so that the
Yes,
food,
additives. Oh yes, food
a lot.
additives,
Yeah.
absolutely.
And all of this just ruins the gut health. That's why today we see more and more children with IBS. We see more and more children with Crohn's disease and all kinds of digestive problems because of the kind of additives that we are giving them right from the time that they are like 3 to 6 months old.
Yes, food additives are another real big factor of causing a lot of metabolic disorders in the future. For and at the time it has been started, last 5 6 years, it has increased more and more, and this is really sad, but it is true.
Yeah.
Additives
And
have really taken over.
yes, and the fact is that the food industry knows what it's doing. It's not that it does not know what it's
Yes.
doing.
No,
Everything has a commercial
absolutely.
value. Yeah, but at the end of it, if we are going to compromise and say taste over quality, then it is
Yeah.
us and our children who are going to suffer, right? And whatever we think we are spending today on food, we will be ending up spending, I think, 3 to 10 times
Health.
more on healthcare.
And healthcare, absolutely.
Yeah. Okay. Now we've spoken about what metabolic syndrome, especially diabetes, fatty liver, and high cholesterol, and all of that, the increasing incidence of that in children.
Yes.
From your experience, when we do put in these changes, like food related changes and a little more activity for the children, from my own experience, once we make the food related changes, the activity will automatically go up because the
Increase.
hormonal correction happens and the child automatically becomes more active, and the fatigue and the lethargy and the body pain and all of that seem to go off. But as a pediatrician, what is your experience when you bring about these changes in children?
They tend to be happier, actually. And another thing is, as you said, because the physical activity goes up, they would start playing their sports, some of the favorite sports. And then another thing, what we were thinking, we promote, as when we see the parents, is family walks. They should go out as in family, as family walks, like not individual. I can't expect a child even 10 years old that go out and do some physical activity, and no, that's not possible. But if weekly twice, if you go with your parents, not much, whatever time you spend, you go for a walk, so that will inculcate the habit of walking. I'm not saying go to the gym. It's walk is more than enough if you do it regularly. So
Yeah.
these small physical activities are, but they have to be done regularly. Twice a week is okay, because I understand parents are not, they are not free, they are busy, and whatever quality time they want to spend with their kids, they want to spend it really. But this is also a good way, because when you're walking, you talk a lot, you communicate. That is also a very good time. Of course, there is an, going to the restaurants, eating out, those are also there, but this can be incorporated a bit. And if they
And
are, then the child understands the importance of walking, and as a teenager, as an adult, it'll grow into the child.
yes.
So we are doing a small investment, and the returns are really big.
Yeah, also the thing of being in nature. I mean, we don't, it's not just about loving
Yes.
nature, but also the benefits of breathing in fresh air and, being amongst plants, being amongst animals. All of this has so much of benefit for us, right? And obviously, when we make it a fun activity, then that's something that the child is going to look forward to rather than look at it as, okay, it's punishment.
And we have to emphasize on the effects when you are changing your habits, changing your eating habits, the effect that you see, that has to be told again and again. The positive, you have to be positive about, and then tell them about the positive effects that they are having. For example, central obesity is coming down. They can wear, especially with the girls, teenage girls, or about 10 from now on, they are very much figure conscious, and they would like to look good. So once the central obesity is coming down, they would start wearing the clothes that they probably once wanted to wear. So they will start feeling good, they'll get more confidence, so it's like a positive cycle going.
Yeah.
And that will help she talks to his other friends, so that's a positive cycle which is going to go.
Yeah, and it should be, of course, when we make remarks to our children, it should be with sensitivity, knowing how to talk to them. If we don't know how to talk about these issues to our children, because we don't want them feeling body shamed, we don't want those issues to then start cropping up. So initially, if we need to even speak to somebody who is used to talking to children, like a child counselor or whatever, as an adult, we may need to speak to them to see how we can communicate these changes to the children, or communicate these things to the children.
Yes, absolutely. Plus, another big thing that when I was in the community, what we used to do was to tell the parents to say no. It is very important for them to teach to say no to themselves, the kids. Sometimes kids from school, they come, they see their peers. There may be some kind of, they may ask for some things, but the parents should have the ability to say no, even if they can get it for them, because then the kids also learn that they learn to say no. So once, for example, this is again teenage, I'm going a bit teenager, if there is any dare situation, like I dare you to do this among the peers, so they can confidently say no and come out of the situation. So
Hmm.
that is also very important. For example, alcohol or drugs, or the things which, for example, the the 13-14-year-old are in a very sensitive kind of that hormonal imbalance state, where they, if the peers are daring them, they have to give in to that, even if they don't want to, because of the peer pressure. So saying no is very, very important. As a mother, I have taught my kids to say no.
Hmm. Hmm.
So this is out, not even a pediatrician, this is just a mother. So it
Hmm.
is very important.
Yeah, so it's important for us adults to be able to say no. And today, parents feel bad to say no, like I'm depriving my
Yes.
child of something.
Yes.
And no, if
Yes.
it is going to stand in good stead by your child, then we should learn how to say no. That's what you're saying, right? In daily life, it would be like if the child is asking for, let's say, again, let's go back to donuts. child is asking for donut midweek, and then we say no. It's I mean, as a family, we've said that desserts from outside will be only one day during the weekend, only one time during
Yes.
the weekend. Is that,
Yes.
does that make sense, or am I being a super strict parent now?
No, that's fine. You have to stick to that one. You cannot. Yes, the child may have done well, and child may come back to you and say, "Look, I've done this." But it's not a reward situation, because in life you will not get rewards for everything that you are appreciated for what you have done. But that, just because, and as a parent, you should never say, okay, you do it, you will get the donut as a reward. That is absolutely a big no in our opinion, because it is, that process should not even be entertained.
Okay.
And food choice, I think parents should make it clear, the deal with food is off the table.
Okay. Okay. That's new. All right.
So donut stays once a week only.
Yeah.
You
So
probably can have yogurt.
yogurt, yes, yogurt, and anything without sugar. A fruit smoothie without sugar. That's fine.
Yeah.
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 So it's
Yes.
been a good
Yes.
discussion, Samita. I hope our listeners are going to benefit, and especially those who have issues with their child's nutrition, and how to talk to their children about food, how to educate their children about food. I hope this gives them some glimpse into what needs to be done. So thank you for your time, and I'm so happy that I got a chance to do this with you. It's been educative for me as well. There are things that I can start looking at when I speak to clients. So yeah, I hope we will have an interview again at some time about some other topic where children and nutrition are concerned.
Thank you.
And thanks again.
Thank you.
Bye, Samita. Bye.
Bye-bye.